Good afternoon to the chair and to the audience. This is an experience with a patient with lung cancer. I have been working on this formulation for the last more than 2 years now in various conditions of edema, and it does work except for metabolic conditions. However, I find since there are not many people from the background of Ayurveda, I would like to, before I go on to this, give a brief regarding the system, what it talks about and what is it in the context. At the same time, I'll also be skipping certain parts of this because they deal with the pharmacokinetics and chemistry of the way Ayurveda works, probably, which may not be coherent to many people. So I would not be delving on it. What Ayurveda sticks to, and that goes back to what we had yesterday regarding the 5-element theory. It goes to the same 5 elements which we call as Kshiti, Jal, Pavak, Gagan and Samir. Kshiti standing for the earthy component or the most solid part. Then Jal is the liquid part. Akash is the cosmic space. Samir is said to be the motion part. And Agni the fire or the energetics. It is such described that it goes well beyond simple nomenclature of earth or fire or water or space, but rather into the most microcosmic forms of even an atom, where the motion of an electron is defined as the property of Vayu. The energy that is emanated is Agni. The space in which it is moving about is Akash. So it's that fluid. And what we believe in is, it directly relates to Einstein's theory of matter and energy, that each of these states is interchangeable. It can change from one state into the other, and that's how, starting from Akash, space, it transduces and transducts itself into the most solid and earthy components, which we call as Kshiti or the earth. Now, coming to this case, I would just take a brief that carcinoma of lungs is usually presented with an edema and inflammation. When I talk of edema and inflammation, I primarily refer to trauma. And trauma is not to be defined by just an accident. Anything that happens to the body is a trauma. And the first thing that happens is an inflammation. Next, following that inflammation is necrosis. That necrosis would cause a certain amount of water to come in and a certain element of edema to precipitate. Now, if that edema is noticed, if you notice that water content in there, at that point you say it is edematous. But when you do not notice it, you do not call it. However, that necrotic element will always cause that fluid part, that water part to be there in that tissue or in those tissue surroundings. Cancer is a self-inflicted trauma on the body. It's not an autoimmune condition, but a self-inflicted trauma on the body, where the body has forgotten its own mechanisms to control certain things, as in this case, cell multiplication, which is continuing and going on. Now, nearly 13% of these cases have edema, and the pathophysiology of the cancer suggests formation of a proteinous gradient which influences ionic environments across the microvasculature of the pleural membrane. Primarily, the body retains a certain quotient of sodium ions which holds water. If this balance across the cell membrane of the sodium and potassium ions is displaced because of any proteinous associations, the cell proteins that are generated in this process, they would usually bind with the potassium channels, leading to an efflux of sodium ions outside, and that would attract more water. At the same time, there are certain channels that would be blocked because of the proteinous gradient that would reduce the flow back of the pleural fluid into the bloodstream or the lymphatic channels. These two things together would combine for engorgement of fluid in the pleural surroundings, leading to a state of pleural edema. Now, this is the combination that I have worked with: turmeric, pineapple and boswellia, shalaki as we call it. And these are extracts. Boswellic acid Pineapple extract is bromelain that I use, and curcumin as in turmeric. Excuse me. All three have their own properties, how they work. These details I'm not getting into the part of it. I'll come to the case basically. Okay, before this is what I was talking about, that the ion exchange mechanisms are impacted due to the protein gradient. Normally the pleural space contains approximately 0.3 ml per kilogram of hypooncotic fluid. If this rate or this fluid quantity is for any reason displaced, normally until it is even 10 times or 100 times, it is not noticed. The lungs have such a proportion to absorb fluid around itself that you don't notice pleural edema unless and until it has gone beyond a very high threshold. So it is very important when you encounter a lung condition, not only CA, it could be pneumonia, it could be say tuberculosis or any other condition, you need to take care of this part. Mostly as far as modern medicine is concerned, they resort to the use of steroids. As far as Ayurveda is concerned, I have tried to look at a perspective or purview of using enzymatic therapy, and that's why I combine curcumin, boswellia and bromelain, wherein bromelain has primarily the anti-oedematic property to be addressed. Also, apart from other things, there is a concept of partial pressures that continues to exist when you talk of gaseous exchange, when you talk of fluid exchange, and that also gets influenced in this condition, because if there is greater pleural filtration, greater amount of pleural fluid coming out, that would reduce the blood's capacity in turn of holding back oxygen in a state, because the hemoglobin is impacted due to the increasing concentration in the blood. This is what is explained as the state in an upper airway obstruction. These things, hypoxia, the central nervous system, systemic vasoconstriction, pulmonary arterial constriction, and these together form to and fro a multiple mechanism of how should I put it, a multiple mechanism of signal transduction, which leads to an impaired state, causing further and further limitation of body's own potential to drain away this fluid that is getting engorged. This is the Ayurvedic view behind it, that when this state comes, all of these 5 elements, the component of Vayu and Agni take predominance, leading to a proteoglycan structure change. This results in a distorted distribution ratio of the earthy component or the solid structures. That distortion is basically more of earthy component coming in, and it is hygroscopic in nature. So this will reduce pressure gradients across the membrane, causing varied gel conditions. That means more and more of resorption of blood into water into the pleural conditions, and the body therefore tries to restore it. However, this flow continues to increase, and this is at the same time impacted by the vat or the dynamic component causing a facial cover over the elements or the zones from where this water could be reabsorbed. So this part is challenging the reabsorption of water, whereas this part is increasing the filtration of water into the pleural cavity. At the same time, both these things, resorption reduced, more filtration, pleural edema goes on increasing. Now, if I were to focus on anything else, it was the case. This was a 43-year-old female who was very weak, and she was first seen in July 2013. She had been Nagpur and New Delhi, these are 2 cities in India. She had been refused any surgical interventions at both these places. She was being given gefitinib as per modern medicine, and she had several bouts of severe dyspnea and pleural effusion with high persistent fever and gastritis. She wanted an Ayurvedic support. The first thing what I had done is I had refused for it, because it never fell into my domain in the first place, and that is when I had referred her for Delhi, where also she had been refused for any surgical intervention, and that's when I took it up. And the part green is the formulation that I have been working and I am talking about. The rest of the other things are basically other Ayurvedic medicines which work in for comorbidities, for support, as well as specifically Carcinoma is an anti-cancer that we have. I did not ask her to stop on gefitinib. However, the patient did discontinue by herself. At that point, at the time of initiation, tapping as a surgical procedure was advised to continue to drain out fluid. I have a table right across which discusses the volumes of tapping that were being done on regular intervals, and it shows that at the first time, if you see, the tapping of the fluid is 3.5 liters, 4 liters, and it was always red in color. It was done from a single locus, right from one point. It was around the 7th and 8th intercostal space that the tapping was being done. However, after this was initiated, this particular combination that I'm talking about, 15th day, 30th day, the first change we noticed was the change in color. It became yellowish red, more translucent towards the plasma shade, and further on, this just changed, kept on changing. What was more dramatic to me, and something that I had not actually believed that could happen, but yes, I had gone ahead, was the amount of fluid that could be drained. It is more important for me to say that at this point, before initiation, she had been given a life of 11 days. God allowed it such that she could live for about 11 months. Well, she's no more. She doesn't exist in this world, and had a peaceful end to her sufferings. But yes, the significant part remains of the fact that the formulation has helped reduce the discomfort that was coming to her life and eased the death. We have these specific parts of bromelain, how it works, then I have what it would cause in a traumatic condition. Similarly, the chemistry of boswellic acid and other things. I would be skipping this and would actually be coming to this synergistic part. The synergy would say that in a traumatic condition, what happens is primarily the solid part, the energetic part, and the space are always impacted, and in a post-traumatic condition, in an edematized tissue, the priorities lie with the solid part, the liquid part, and in those conditions the inflammation is reduced. That's why you don't see me mentioning Ag, which stands for Agni, or the fire, or the inflammatory, or the heat that is sensed. From clinical experience, it is known and understood that once edema develops, the tissue does not sense warm. It always senses cold. Until inflammation exists, you will have the sense of rubor, the sense of heat. But if edema has persisted for some time, the sense of heat would go down, the sense of inflammation would be changed. It would not appear red. Now, once it is exposed to this environment, by different mechanisms, what happens is that bromelain, boswellic acid, and curcumin, all three work in three different pathways. While curcumin acts such that it emanates water in the form of heat, boswellic acid and bromelain cause resorption by different mechanisms. All three synergistically reduce the water content in the surrounding tissue, reducing thereby the edema of the tissues. And what I would want to just conclude here is that on various likely models, and these are models, actually Ayurveda has not proposed any synergistic models that would conform to modern medicine. We have a lot of things that are abstract. So we need to look at likelihoods. We need to look at possibilities, how these models, how these drugs, how these individual substances can work. Therefore, whatever I have put across are likely models. And these likely models and the clinical table are of significant importance in terms that this therapy acts as a good adjuvant. It's not a cure. Remember, I'm not talking of it as a cure for cancer. It is an adjuvant therapy which reduces a certain amount of difficulty, a certain amount of complication that arises with most cancers. It's not only lung cancer that would cause pleural edema. Even pleural edema is seen to occur in colon cancer. It is seen to occur in
oncological doctors. They didn't treat these patients, and they have nothing more to do. And they don't call themselves alternative medicine. No? I think that alternative must be taken out from this, from now to then. Not more alternative. You made a treatment. If we all really agree with that, no more alternative. You made a treatment because this woman could breathe 11 months more, and the family could take care better of this woman, and nobody makes nothing more. The only thing that I disagree with you. You know what I think about the light.
Well,
I think we must not anymore put alternative for all of us, because this is a very good example. It's not alternative, it's a treatment.
Well,
perhaps it can cure, but it's a treatment. It's not an alternative, nothing.
Actually, thank you for the applause. I just believe, coming to your point, that medicine is medicine, and it is always a synergy. Coining of terms like alternative, complementary, these are more of marketing jargons that have come out of big pharma. And people who understand marketing and the business part of pharma industry, they would probably agree or disagree depending on which side of the fence they stand. But that's a story which entirely unfolds across millions of dollars across the world, millions and billions of dollars that play into the pharma industry. But the human being, the human individual, is not beyond what every one of us is. And medicine or no medicine, it's more of a question of faith. As far as, and that's why faith healers across the world, they exist. Even they are not, even those, I mean, they're just not recognized in any system of medicine, but they exist, and they probably play a greater role than most of the qualified health practitioners across the world. So it's just a question of faith, and we need to develop something wherein the gap of the use of such terms as alternative, complementary, etc. is not there. It's more of an education.
Look, we were talking about healers, and the first thing that a primitive man do with another wounded man, human being, was getting aside, accompanying him. That was the first medical treatment, to be with him. That's the first treatment. So we are healing, accompanying our patients. So they are also, that's also medicine.
That is.
I think we must respect very much. I don't know if you agree. Yeah, we are taking very seriously what I'm saying. I'm very emotional to say this. The first thing, we were accompanying the patient.
That's why Hutchinson, I mean, the clinical Bible for modern medicine, he states in his first chapter that the touch of a practitioner, that is the most important part for a patient. And that's what a healer, a faith healer does. So there goes your point that a companion is what you need. Thank you. Yes,